Let me share the screen. Please, guys, if you see me on Facebook Live, please let me know while I'm sharing the screen same time. Guys, I'm on Facebook Live. Can you see me there? Can view. Guys, can you see my slides as well? I have shared my slides right now. These guys, if you can see the PowerPoint, let me know as well. Thank you. Let me double check. Today's session, guys, will be a very interesting session. And I believe we're going to learn lots of important information here today. Seems like I can see myself live right now on the Facebook. Okay, yes, that's true. Dr. Sandra, how are you going? Dr. Muhammad, how are you going? Dr. Neshma, Dr. Sepia, Dr. Natalie, Dr. Nishma, Dr. Shama, Dr. Lev. Guys, I'm very happy, guys, seeing you. That is great. I'm very happy, guys, seeing you now. Okay, that's good. Then let me just let's start right now. Home. Good, good, good. Home again. Yep. Just as bigger to be able to see. Everything's perfect. Dr. Sanchari, how are you going? Dr. Sanders, how are you going? Dr. Patel, how are you going? Dr. Shiva, how are you going? Guys, I'm very happy, guys, seeing you all here today. That is great then. Okay, let's start. Before we start, actually, we made a little surprise to you. Guys, am I audible, by the way? Dr. Beshwan, how are you going? Dr. Shreya. Thank you, Dr. Sanchari, very much. Long time I haven't seen you, Dr. Sanchari, about only 2 hours, right? 1 hour, maybe, or 2 hours in the academy. That was a long time. Okay, guys, today actually we're going to have a good surprise. We will have one of our champions. Guys, you know, guys, how much you are very valuable to us. How much we are family. And this is the things actually not existing anywhere else. It's only existing in Australian Dental Academy families. Every candidate, they care about the other candidates exactly as if they care about themselves. And this is the best about Australian Dental Academy and how we are very successful. And that is the reason why every time, either in part one or part two, we are the leaders. We are the first academy with the highest rate ever. That's something unique. You cannot find it anywhere else. Saying this, today we got one of the amazing dentists ever can meet. She's very nice. She's very cute, I would say. She has a big heart. And then once I knew that I'm going to session today, she said, "You know what? I think we need to help our family. I will give them a little bit of brief about how they can pass part one and part two exam." Guys, how does it sound to you? She has Dr. Nikita. She's our amazing dentist today. She has passed her exam last week, or last 2 weeks. So she guys came and then she said, "I will be very happy to have to help all the candidates to give them a little bit of brief about what they need to do to pass part one and part two." Okay, Dr. Nikita, can you hear me?
Hi, Dr. Widow. Yes, I can hear you.
I'm very happy. Thank you very much, guys. Everyone, guys, can hear Dr. Nikita.
Hello, everyone.
Dr. Liv is very nice. By the way, Dr. Nikita has been our part one champion before, and then you know how we run a part one. You know when you have good people in part one, they helping each others.
Yeah,
That's exactly what we got right now and always in part one. And Dr. Liv, one of them, he's always there. He's always paying attention. He's always helping the rest of the candidates, and I really appreciate him. Same like Dr. Sharma, same like Dr. Shiva. Look, I don't want to really forget anyone. Definitely Dr. Tejas. I know him personally very much as well, and I'm always proud of him. So I'm really, really proud of these champions, and I wish all of them all the best. So please, we need to help them the most, as much as we can, Dr.
yes,
Nick.
definitely. Yes,
By the way,
definitely.
I would love to congratulate you first.
Thank you so much. Thank you.
I know how was a journey.
Yeah,
Look, and then when I met you personally, and I knew how much you're a good person, big heart, you're very smart, and then one of the dentists I definitely can trust.
thank you so much.
Thank you, Dr. Nectar. Yes, please. Look, guys, she's happy to help you, and then that's why she's here today, to everyone.
Yeah, sure. So definitely, I'm here to help you all today. So you can ask as many questions as you want throughout this session, and I hope your preparation is going really well. I'll be just giving you some tips and how was my journey, what exactly I did for part one and part two, and then we can discuss it later if you want more. Can I start, Dr. Bida?
Yes, please, doctor.
Yeah, okay. So, starting with part one, so I joined Dr. Bido Academy since part one, and I've been with them since then. I got to know about them actually from my friend. She heard from many people in the clinic that she was working. So that's why I got to know Dr. Bido, and I'm happy that I joined Dr. Bido's Academy. So for part one, it was a really short journey for me for part one. Basically, I passed in my first attempt. So what I did for part one is I I actually prepared only for 2 months for part one because I didn't have much time before that. So for 2 months, I was actually not working. I took time for part one, and I was actually working 8 to 10 hours a day for whole 2 months. And what I did is basically I just read all the materials that Dr. Bido had given us. I read it at least twice, all the material that he had given us. I followed all the plans, all the study plans, and also I attended the lectures. I think that's really important for part one because it's really really important for especially for part one that your concepts are really clear. And I can say once you attend the lectures, Dr. Bido's lectures, he's mainly focusing on clearing your concepts, and he will guide you how to think critically to solve that question. Because I believe part one is not theory based, but it's mainly practical based scenarios, and you have to think really critically to solve those questions in that exam. So I would recommend just give your time. for ADC, attend all the lectures, take down notes, and attend all the classes, and also read the material, and also Dr. Bido's mock exams for part one. They really help as well. So just do that. And also TG is also important, as many of you must be already aware about TG. So TG is also really important for part one. So go through everything again and again until you feel confident, and just be consistent. Part one is easy if you are on top of everything and you're giving your 100%. Also, the other thing about now coming to part two, part two is a little bit different than part one, I believe. So basically, there are multiple things in part two that you have to focus on. You have to focus on technicals, your OSCEs, and skilled OSCE as well. So for basically for technicals, what I did for part two is initially what I did is when I was not working, like on weekends or any holidays, you can actually finish all the 6 technical tasks on one day, in one day, and also you can do your OSCE set as well on that day if you're not working. But for my this attempt, I was actually working full time. So what I did is I actually did 1 or 2 technical tasks in each day, and then 3 OSCE cases per day that I did. And I also actually, this time what I did is I actually followed all the materials that Dr. Bido had given for part 2 as well, like all the articles that he had shared and his study plan. So that's really important. We think that for OSCE, it's only the cases that we have to practice for 10 minutes and that's it. But it's really not like that. You have to gain maximum knowledge from wherever you can. And I think Dr. Bido, the notes that he has given for part 2 as well, they're enough to boost your confidence in your role plays. So basically, it's not like you will use all that information in those 10 minutes, but basically that information, that knowledge will give you confidence to do your role plays in those 10 minutes in exam. For most of my role plays, basically, I did practice those with my husband, and what he did is so initially he was asking me same questions, but then he actually used to put the cases on ChatGPT, and then after explaining everything to ChatGPT, it was actually giving the examiner questions to him, and then he was asking those questions to me. So in that way, we really use ChatGPT a lot. And also I did many role plays with Dr. Bido and other tutors in the academy. Also for part 1 and part 2, what I think that helped me is basically the Telegram group of like OSCE support and technical support group, the groups of Dr. Bido on Telegram. Whenever I had any doubts or any questions, what I used to do is I used to search in those groups, and then I used to find the answers there, because many people have discussed lots of things in those groups. So any doubt that you have, you will definitely find an answer in those groups. So that really helped me as well. And also, for skilled OSCEs, what I would recommend is at least a month before your exam, you can start practicing skilled OSCE, like 1 skilled OSCE, 1 station each day, if you do that. Because what happens, most of the candidates, they focus on technical and then OSCE, but they, somehow skilled OSCE gets ignored. So it's important that you give importance to that as well. So try to do 1 task each day, at least a month before, or say 20 days before your exam. That should be fine. And also if you have any doubts, say for technicals or skilled OSCEs, you can definitely, what I've done is I've also given a mock technical exam in the academy before my part 2. And also I took some supervised skilled OSCE sessions in the academy as well before my exam, just to revise everything, and that boosts your confidence as well. That really helped me. Now, also, I wanted to tell you, like for OSCEs, try to attend all the lectures. Or even if you've attended them before, just do it again and again, because basically every time you attend a lecture, you get new information out of it. Even even a single information that is new, that can be helpful in your role play. So what I've done is I've made notes for each cases, for each OSCE case, and whenever I used to get any new information, I used to add that in my notes for that particular case. So you have all the information for that particular case in one place. So that also helps you. And the other thing is, the main thing about this exam is, I think there are some key points about this exam that basically you have to be top on, like, because basically there are points you can consider during your preparation, and there are points you can consider during your exam. So basically during your preparation, the most important, I know ADC journey can be really long for some people, really tough, and what you need to focus on is you have to be consistent with your preparation, and just don't give up. Try giving your 100%. Your dedication and hard work and your consistency will definitely help you achieve and crack this exam. Just practice over and over, and that will make you really perfect. And also during your exam, my personal experience, what I feel important is basically in ADC, especially part 2, I think stress management is really important in this exam, because you will be under a lot of stress. You will have time pressure as well for each OSCE and even for your technicals. So stress management is really important. You have to be confident on yourself, and you have to calm yourself when you go on both your exam days. When you go there in that exam room, just calm yourself. Try some methods that you can calm yourself during the exam, and that will really help you. So that's all about my experience for part 1 and part 2. And I really want to say that it's whatever efforts that you are taking, those are really worth it. And you will definitely, once you pass this exam, you won't remember your efforts. Like seriously, you won't remember your efforts. You will be just relaxed and happy. So all the efforts that you're taking, those are really worth it. So just give your 100% and be consistent. If you have any questions, I'm happy to help you.
Okay, guys, please, thank you very much for this detailed information, Dr. Ramp. I really appreciate this. And
No
this is
way.
the way always. Have you attended any of the session before, doctor, before you pass your exam?
Like, yeah, I used to attend this Tuesday session and all the like classes. Yeah. Like all the role play OSCE classes with Dr. and Dr. Raj and your classes. I have attended those.
Yeah.
And I used to attend your Tuesday clinical case as well. So I've done a few role plays with you on Tuesdays as well.
That's great then. And this is what we tell the candidates. You really want to pass this exam. I believe one of the things is consistency, as you mentioned.
Yeah.
And then attend the sessions, because they're really gonna get like very good help from the champions like you who has passed the exam. They get good information what we discussed today, and they really gonna have better understanding about EDC journey itself.
Yes, and every time they attend the session, there is always some new information that they can get and use that in their 10 minutes in exam, and that can be very important as well.
I totally agree on this. That's why I'm saying it never be a reputation to attend the sessions. It's always good to attend the sessions. So in this case, we get more information every session. Every information is something new happening.
Yes, definitely. Yes.
I totally agree on this. Let's see now. I see comments on the. If any one of them they ask you questions, let me just double check this.
Yeah.
Okay, they just start the journey right now for part 1. So what is your suggestion for every candidate? They feel they are lost. They don't know from where they should start.
Okay, so basically, I know it is a different path that we've all taken, and I understand that you might not know everything at this stage because you have just started your journey. But what I would recommend is just follow Dr. Bido's plan that he has given you. Just start studying. Study the notes that he has given you. Attend his classes, and give mock exams that he'll be planning for you. And I believe you will be on the right path once you do all these things. And TG as well. TG is also important. So start reading, and just be consistent. And you can follow, Dr. Bido gives the study plan as well. So you can follow that, and that will be helpful for you all.
That's great then. Okay. Doctor, am I audible?
Yeah, yes.
Okay. So thanks very much for this, Doctor. Please, guys, if you have question, start ask. I see the question here right now, and everyone from our champions, they actually thank you very much and they congratulate you. It
Thank you,
started.
everyone.
Thank you very much. It's starting from Dr. Jasmine, Dr. Shama, Dr. Tija say congratulations, Dr. Nikita, Dr. Fatima. Hi, Dr. Fatima, Dr. Sanchari, definitely. And then Dr. Muhammad, he say hi to you. Dr. Shiva say thank you, doctor. And then Dr. Weni, I like her name. She says thanks so much, Dr. Nikita. And Dr. Ponima says thank you, Dr. Nikita. Plus Dr. Fatima says, thank you, Dr. Nikita, for the advice and congratulations to you for the achievement. Dr. Lev, thank you for, Doctor, your experience is really important to us. If you could do it, we also will. What do you think about this
Mm,
motivating?
Definitely, definitely. First of all, thank you everyone and all the best to everyone. So definitely what I can say, if you're giving your 100% and you are taking efforts in the right direction, then definitely anyone can do it. This exam is not hard. It's just few points that you need to work on, and then you will be there, definitely. Just be consistent, be dedicated, and motivation is also important for this exam, basically. So there might be some days where you won't feel motivated enough, but try to find some things that can actually motivate you. So what I did, I used to, um, sometimes I had gone through that journey. So sometimes I used to feel really low and not motivated to study, or sometimes depressed. But what I used to do is I used to scroll through Instagram reels, and I once accidentally I saw a reel about the exam, and or the positive reel about that. So I used to get those reels constantly, and they actually motivated me. But you can find your own motivation somewhere, but definitely that's really important. And anyone can clear this exam. One day you will definitely be on the other side, and it will be all worth it.
Okay, very good. Then thanks very much, Doctor. Dr. Sandra asked question. Hello, Doctor. Congratulations. Would you tell me how you plan to study during the final days of preparation? So which material you gonna prioritize?
Which material?
Yes, the materials, they said there is how to prioritize those materials, the materials we provide them,
Yeah,
and
okay.
during the time, asking about part one. She's talking about part one.
Part one. Okay, yes. So for part one, doctor,
Sorry, guys, and attention, please. Dr. Nikta passed her part one first attempt, and she did only for 2 months preparation. I don't know if you have mentioned this or not,
yes,
but that's what
yes,
I remember.
yes,
Right?
yes, definitely.
So
Yes,
what did
yes.
you cover in 2 months then? That's gonna be the best answer then. What did you cover in 2 months?
Honestly, I only covered your material that you had given us for part one, all your mock exam questions, the study notes, Bedo batch, like all the material that you had given us. I only read that. And I believe I went through that material at least twice in those 2 months. And also your lectures. So that's the only thing that I did for this 2 months. And TG, of course, TG is important. So that's the only, and I went subject wise. So basically, I took one subject, say for 1 week, and I finished all the material in that time, the material that you had given. And then once I finished all the subjects, I started again, So that's everything that I've done in those 2 months. Yeah, if you follow all the material, all the classes, all the mocks, then definitely you will be fine. And just make sure you're getting your concepts cleared for part one, especially because critical thinking is important in part one. So once you do that, a part one is easy to crack.
Thank you very much, Dr. Nick. This is great. Then, and by the way, this time we do Bit Delicious and make the things very easy for them. Bit Delicious.
Yes, yes.
You look. You wasn't lucky. You weren't lucky at that time because it was
No,
not Bit
yeah.
Delicious at that time. But this time, TG now is very easy for them. They don't need to read to go through any type of lots of reading or confusion. We simplify things to them in TG, and then the other important subjects or topics in a form of Bit Delicious. So
Yeah, so you've already made it easy for them. So definitely, then it will be much easier now.
I agree, and I wish I try to do my best to make things easy for them. So I'm really also feel very happy when things get easy for them.
Yes,
And thanks so
definitely.
much coming here today and help all of them. That's guys the spirit. This is spirit you cannot find it easily. That's why our candidates is always special. Our I always say we lucky. We got special champions in the academy or in our family. I really appreciate this.
Yes, definitely I agree. And thank you, everyone. All the best. And thank you, Dr. Bido and your team. The support that I got throughout this journey was really great.
Thank you, doctor. Okay, one more question from Dr. Fatima. Doctor, did you have a study partner for part one or part two?
No, for part one, no, I didn't have anyone. Like, you don't need a study partner for, like, if you have, that's really good. But you can do it on your own as well for part one if you don't have anyone to discuss things with. But for part two, I had a study partner. I have my friend. We did some role plays together, but most of them I have done with my husband. So, um, yeah, for part two, you need someone to do role plays with that because that's really important to practice role plays in 10 minutes. But for part one, you can still do it on your own.
Yeah, I totally agree on that. Thank you very
Yeah.
much. Dr.
All right.
Karim says, congratulations, Dr. Nikita. Nikita, wishing you the best for your lifelong clinical practice. Very cute, Dr. Sanchez.
Thank you, Dr. Sanjay. Thank you so much.
Yes. Dr. Fatima, Instagram reels are never ending. Oh, duh, don't waste it. Like, she's going to say all that she said because Dr. Nikita mentioned about Instagram reels. Every time I
Yeah.
ask her, did you study? No, doctor, I'm on reels. Why? Because Dr. Nikita says she just watching them. But,
No, just only when you need motivation. That's when I use
okay.
it. Yeah.
Yes, I agree. And it's not all the time, okay?
Not all the time. No,
No.
don't use it.
Dr. Shrey says, thank you, Dr. Nikita, and congratulations to you. And then
Thank you.
same with Dr. Sarah and same with Dr. Sana asked question. Did you read textbooks? That is a question from Dr. Sana. Did you read textbooks?
Uh, so I only read text like for part two. No, even for part one and part two, I only read materials that were given by Dr. Bido. And at my, I think during my time, there was no Bidolicious or Bido Bites. So he had shared some material with us. So I only went through the material that was given to us, nothing else.
Oh, well, that is great. And thank you very much. Yeah, that's one thing the candidates is not really very hard right now. It's more about critical thinking, what we discussed today. Information is easy to give it to them. And look, it's I have my own experience how to give them the materials, and one
Yeah.
sort of materials it should be. But in same time, I would say critical thinking and clinical judgment, the things really that gonna make their life much easier, and they really be able to choose between the right how to manage things in the clinic and to approach EDC answers easily.
Yes, yes. So theory only is not enough. So you need to have the critical thinking part. And for that, you need to get your concepts cleared for part one, especially.
Yeah, Dr. Lev says, can we use your experienced husband as a study buddy?
Yeah, sure.
Yeah.
He's now his second dentist now.
You
He's
see,
gone
that's
so
always
many
happen in the
questions.
family. Yes, it's always
Yeah.
happen in the family.
Yeah.
Okay, Dr. Winnie asked like about that's okay, Dr. Winnie. We will actually let you know about this. Dr. Stana say thank you very much. Okay, now thank you very much for this. Also, would you love to give them the last, I would say, the last advice, or what do you think? Like, because now, even you are very welcome if you stay back, because I'm going to discuss um, um, a clinical scenario, a clinical session with all of them to get a good experience about critical thinking and the clinical judgment. Would you like to give them the last suggestion, last advice?
Yes, sure. So basically, what I would say is, especially for part two, as I said before, I feel the important thing is stress management and also confidence on yourself. So whenever you go to the exam, whenever you are outside in the corridor for OSCE, just before entering each room, just make yourself calm and tell yourself that you know everything. Be confident and you deserve it. That's what will make you pass this exam. So just be confident, and because you all deserve to be a dentist. You are already a dentist, you just need to get this license to practice in Australia. So basically you all deserve it, and you all know everything. It's just some stress management, time management, and confidence on yourself. That's important thing.
I would say that. Thank you very much for this, Dr. Nick. I really appreciate this, and all the best to you then. And
Thank you so much.
As Doctor, I believe that was from Dr. Sanchari when she said she wish you the best for your lifelong clinical practice and overall your life, definitely, not just on the clinical practice, overall life.
Thank
Thank
you
you very
so
much.
much. Thank you, everyone, and all the best.
Thank you, and I really appreciate you coming today to help the candidates. I really appreciate this. That's a
No
big heart.
worries.
You have
All
big
good.
heart. Thank you very much.
Thank you. Thank you. Thank you.
No problem. Thank you. Okay, guys. Now we're gonna start our clinical case. Guys, are you ready for the clinical case? You guys, are you ready to learn more about EDC exam? Who's guys ready to do that? Who are the champions ready to do that? To learn from a role play how to get the right answer, the correct answers when you get the questions either for part one and part two. Dr. Albert says, thank you, Doctor. We are ready. Thank you, Dr. Bishoy, Dr. Sanchari, and every one of you guys. By the way, for part one champions, I see you guys you asked me when we going to start the course. Most probably, guys, we're going to start. We're going to do Telegram group by, we already made a Telegram group, and then we're going to add you in Telegram group for September 2026 candidates this week. And then we're going to start our sessions, or the session, private session, I believe, by next week. We're going to update all of this on the Facebook and also on Telegram group. So, guys, let's everyone to be ready and let's do our best and enjoy the journey. Okay, everyone's ready right now, guys. Who is ready to do role play today? I see, guys. If you are ready to do role play right now, please raise your hand so we can do the role play on OSCE. Sorry, on Zoom. I see Dr. Nav. She's raising her. Hi, Dr. Nav. How are you going?
Hi, Dr. Rita. I'm good. How are you?
Good, thanks, Dr. Nav. How are you going, Dr. Nav?
Sorry, Dr. Rita.
How are you going, Dr. Nav?
I'm good, Dr. Rita. I'm doing good.
Dr. Sanchari as well, raise her hand. Dr. Bishoy as well, raise hand. Yes, please, Dr. Sanchari. How are you going?
Hello, Dr. Biro. I'm good.
Thank
How are
you.
you?
Thank you very much. Dr. Wayne, raise hand. Dr. Hassan, Dr. Bishoy. And I really appreciate all of this. So, guys, who's ready to do role play? Are you Dr. Sanchari or you, Dr. Nav? Who's guys willing to do it? I'm happy, guys, even to do both of you.
We can do it together, me and Sanchari.
Together? That would be a good one then, right?
Nav can go first and I can go second. Yeah, that sounds
Okay.
good.
Okay. That's good then. So, okay. Let's do something. One do it today and then maybe one next Tuesday. What do you think?
Yes, That sounds perfect.
Okay, so guys, I'm happy now. Who's guys can do it today?
Do you want to do it now?
Yeah, I don't mind.
Yeah, okay.
Okay, so Dr. Nav now and you, Dr. Sanctuary, next week?
Yes, sounds good.
Okay, that sounds good. That's
Thank
no,
you so
thank
much.
you very much. No problem. Okay, Dr. Nav, how are you going?
I'm all right, Dr. Bida.
Good. Excited for role play? Excited for the role play?
I am
Yeah, very good then. I'm very happy to hear this. Okay,
always.
now I'm share the screen already, but let me more. Okay, give me 1 second. Would you like to discuss the role play first? Because I have done a bit of changes and some information here and there. Okay, and then we needed to work it out. Now, let me just get this one here right now. I'm very happy to discuss the case with you. Before we start, that's the case. Can you see it? Hello? Dr. Nev, I think I cannot hear you, Dr. Nev.
Can you hear me now, Dr. Bida?
Now I can. Before I couldn't, yes. Can you
Can
hear
you
me?
hear me now?
Yep.
Okay, sure.
Okay, great. Then can you see the case?
Yes, I can see the case.
Okay, that's good then. Give me 1 second. Okay, guys. Today, guys, what we're going to discuss is we're going to discuss about, as you see right now, we're going to discuss about, let me just tell you. Please, guys, everyone, please ensure you follow the Facebook page, a Facebook group, because actually we're going to go all the updates one by one until you reach the highest and the best level ever for ADC exam. Now, what we're going to discuss today, guys, we're going to discuss about luxation injuries and then crown fracture, either complicated or uncomplicated, depends on Dr. Nav, what she's going to diagnose the case, decision making in clinical scenarios, consent part, how you get a consent, splinting types and duration, managing of anxious patient or the parents, managing an angry patient because I will be angry and upset sometimes, the necessity of antibiotics, and the interpretation of clinical findings. What you see, this is all important to you. This all very important to you to answer the questions in the right way. Dr. Nev, you ready? I think sometimes I cannot hear you. Sometimes I think it's my speaker. I think so. Hello? Let me get this back again. Guys, can you hear Dr. Nav, Doctor? Guys?
Hi, Dr. Bida. So sorry, I switched devices because my phone battery was on low.
That's okay. That's okay then. Are you okay? You back again? Everything's fine? Yes, everything's fine now?
It's all good on my end.
Okay, thank you very much. Okay, that's great then. Let's start. Okay, would you like me to discuss the case or you ready with it? Which one? Tell me, please.
I will take couple of minutes, Dr. Bida, because this is a new case. I haven't read it before.
Okay, I'm very happy. I can read it with you if you want. We can read it
Please.
together. We can highlight the most important information in this case together, okay?
Please.
Okay, give me just 1 second, please, because I try to get a timer on the screen as well. Uh, that is 3 minutes reading time. I will not start now until I get the case. Okay, the case right now. The patient age is 14-year-old and she's a girl. Her name is Sarah. Presents to dental clinic in Parramatta in Sydney. Accompanied by her father. That's me. My name is Michael, okay? I'm Michael, her father. Following a fall at school earlier today, her father reports, which is Michael, it's me, that Sarah fell forward and struck her upper front teeth, resulting in pain and bleeding. She is otherwise healthy with no significant medical history. Means like you don't need to refer her to hospital or any medical evaluation for now. She's okay. Clinical examination reveals trauma to the maxillary anterior region associated with gingival laceration. That is the first diagnosis. The first diagnosis case is gingival laceration. The second diagnosis is, okay, one another symptoms here, or signs, or investigation, or test, call it the way you want, which is called test, shows exaggerated response. Very important to talk about this part. So it's very important to talk about gingival laceration. Very important to talk about cold test, and you explain what has happened as positive response to tooth number 11. So 11, this tooth has pulp exposure, as you see right now, and it does response to vitality test. What does it mean? By the way, I'm going to explain all this in details in here. We're going to go in details in every single findings, diagnosis, pulp testing meaning, recommended x-rays, interpretation of results, and then how to explain to the parents, immediate management, and then tooth number 11 management, tooth number 21 management, splinting, and all this stuff. I have even lots more things to discuss. But initially, I would say tooth number 11 has pulp exposure, and tooth is still responsive, and this is good sign to us. When we have a tooth responsive to vitality test, that means a really good sign that the tooth in the future can regain its vitality back again or its responses back again. While tooth one is not responsive, this is initially as a base test. It's not confirmatory. That could be initial sign that this tooth can be tooth number 221 can be necrotic. Now, the bone is locked to bone and immobile. So now the tooth is immobile, locked to bone, and locked this way. So what do you think is the diagnosis, doctor? And everyone, guys, can these guys tell me what's the diagnosis in this case then? Tooth number 21 has been, as you see on now, guys, displaced palatally, the crown palatally, and then locked to the bone, and then immobile, and tended to percussion. So what do you think it is? Dr. Nev, are you able to talk?
Yes, doctor, it's lateral luxation.
Thank you very much, lateral luxation. I agree on this. Okay? So it's a lateral luxation case based on the information provided here. So now, your bold part is explain the findings to the parents. So you need to explain to me the gingival laceration, explain to me the exposed pulp, tooth number 11, which is complicated fracture, explain to me lateral luxation, explain to me the vitality tests has happened, both of these two vitality tests, and the significance of the vitality tests, and then obtain consent about what you do. So the treatment, what are you going to do? Definitely tooth number 11, we need to do civic pulpotomy. And then you don't need to explain too much about what is civic pulpotomy, but at least to give me a little bit of brief what you need to do. And then explain what you're going to do with tooth number 21, which is mostly splinting. And what type of splint, how you can do splint, how many teeth you can splint, when you need to see the patient back again, and all this management part. Now, if you are at any stage or at any time forget any of the information, you can ask me right now before even you discuss this. So, do you think you forget any information here? Splinting. Do you know for how long we need to splint this tooth?
Dr. Bido.
Sorry, do you know how long? 4 weeks. Okay?
Yeah. Sorry, with the 1-1, Dr. Bido, is it exposed to the pulp?
Yes, exposed. Yes, it has exposure. It does mention here. Yeah, with pulp exposure.
Yeah. Okay, sure.
Okay? So you need to do civic pulpotomy. Do you know which material you're going to use for civic pulpotomy? I'll make it easy for you. Either MTA or calcium hydroxide. You can say in exam just a medicine. Okay? We're going to put the medicine on top of the exposed pulp. Okay, do you know for how long you're going to splint this tooth?
Yeah, Dr. Bido, 4 weeks with the flexible wire.
Very good then. Do you know how many teeth you're going to splint?
2 canine to canine.
It could be. Or it could be for just only 3 teeth, one front, one the back. That's enough.
But the canine will give more stability, isn't it?
Look, that could be your clinical judgment, which I agree on it, but mostly the guidelines, they like to be conservative in it, and they just make like one tooth front, one tooth the back. But if you say canine and justified, that will be okay as well.
But sorry, Dr. Biro, I missed the guideline. So guideline will be from lateral to lateral, is it?
Will be from one tooth in the front, one tooth from the back. So most probably that's the tooth need to be splinting. So from lateral to central, like three teeth in total. One, two, three.
Sure.
This. If you want to extend the motor to canine, will not be an issue. And if this is what you believe is gonna be good, good, it's fine as well. Because the more you splint, the less hygienic can be. So, but anyway, I would say. And by the way, the less you splint, the physiologic tooth movement will be better. So the risk of inflammatory root resorption and ankylosis will be less as well. However, that's okay from canine to canine as long as justified for better stability. No problem. Do you know what we're gonna do after 2 weeks?
We're gonna do the vitality test, and if there are any signs
Thank you very much. For what? To assess RCT, right?
as well, if
To
they are.
assess. Yes. Very good. I'm very happy with this. Look, I was expecting maybe you may get confused about this case, but I'm very happy. You just do it right now. Okay?
Dr. Biro.
Okay. Do you have any question to me before we start?
Yes. Regarding the gingival restoration, what are we doing for that?
For gingival laceration, doesn't look really deep, so no antibiotics required. It's just a hygiene and then maybe salty water from time to time.
Sure.
That's it. No more than this. No, even chloroxidine, because we don't like betadine or chloroxidine when there is an open wound like this. Okay. And painkiller if it's painful. So, are you stressed at all?
A little bit, Dr. Biro, but I'm not stressed. I'm just say a little bit. Heart is beating a little bit faster.
Okay, you don't need to go faster. Just slow down. It's good. It's not about how much information you can provide me, but how good decisions you're gonna make.
Yes, Dr. Biro.
I need good decisions today. Okay. Ready? Let's start.
Dr. Biro, let's start.
All the best to you then. Let me just get the timer back again. Then let's start. Where brought the timer gone? I had the timer before. Maybe I need to make this one bigger. Yes. All the best to you. 2 or 3 minutes. Which one? 2 minutes? 2 minutes. We will discuss the case. All the best. 2 minutes.
No, 10.
Can you see the timer? You will find it on the side on the screen.
Yeah, I can see Dr. Biro.
Very good. Then all the best to you, Dr. Nair. One minute left. Twenty-five seconds left.
Kidding me, Dr. Biro.
Are you stressed? Don't be stressed, okay? You know what? No time left. You can start now. No, I'm kidding. It's just still 10 seconds left. You can start now. All the best to you.
Hi, Michael and Tara. My name is Dr. Nav. I've before, but are you guys doing okay and nice and comfortable for me to explain what we have found so far?
Doctor, not really, doctor. I'm really very stressed and anxious and really bit upset what's happening today. Look, doctor, thanks very much for saying us. Sarah had a fall at school today and hit her front teeth. There was a fair bit of blood and she's in pain. So we wanted to get checked straight away, doctor. I'm pretty worried and just want to understand what's going on and what we need to do today. Please, doctor, look, I'm here today because I know you're the best dentist in the town. I trust you very much. Please help us.
Definitely, Michael. I will help you guys. I know it's a stressful situation. She had a bit of a bleeding and she had a fall. Don't be worried, Michael. I will try my best to comfort you guys and Sarah as well during the treatment today, okay? And we will keep it very nice and short so she can go home and have a bit of a rest, okay?
Thank you, doctor, very much. This is my expectation, doctor.
Yes, and before I start, Michael, do you mind me explaining how did this happen? Like, was she playing something or it was just a general play?
Look, doctor, it just she was plain and then had a trauma to her upper front teeth, and one tooth has been knocked and froze inside. I believe this is my explanation. I'm not quite sure. You are the boss. You know better than me. And the other one has taken a heavier hit. I'm not quite sure why this. And there's some injury, I believe, as well in the gums. I've seen this. Doctor, can you tell me in simple terms what actually has happened as based on your findings, doctor?
Definitely, I can explain, Michael. So have a look at with me with this picture. So you can see there is a bleeding happening around the gum. Yeah, and
Yes,
then
doctor.
if we look at the teeth on the left hand side, Michael, you can see there is a part of the tooth that has broken. Yeah.
Oh. Doctor, is
Um,
this is actually something serious?
I would not say it's serious, but we have to keep an eye on them because she is 14 years old and these are her adult teeth. So we have to keep an eye on and go a really good treatment so they will last her lifelong. Okay. So as
Sorry, doctor, this is very good, very point I really discuss. So, doctor, do you think can you can you save the teeth, and which one can have better prognosis of outcomes in the future, doctor?
we will discuss everything, Michael, today. So as I was explaining, this one has a fracture, and I did my nerve test on this tooth. Okay, with the and we call it a vitality test. So the response came out to be positive. What it means that there is a pulp exposure, which is a nerve that's the innermost layer. Okay, which we always try to preserve because that keeps our tooth alive. Does that make sense, Michael?
Yes, doctor. So, which one has better outcome in the future, and which one we can save?
The better outcome, look, we will try to have a better outcome for both of them, but if I'll have to say it now, which we won't be able to predict, actually we have to see how they are going. We have to keep an eye out. So the one on the left hand side will have a better outcome, I will say.
Okay, the one the left hand side. Do you mean the one which is knocked away, or the one which is just has a chipped part out of it?
The chipped part out of it.
Okay, the chipped part out of it. Okay, doctor, thanks. Doctor, what are you going to do today, doctor? Look, I'm really very stressed and anxious, doctor.
Don't be stressed, Michael. I will look after her. Sarah is like my own daughter, so
She's
don't worry.
lovely. She's lovely. She's very
Yeah.
cute and lovely girl. She's very polite and lovely.
So what I will do, as I said, I will keep it very nice and short today, Michael, for her as well. So what I'll do, because there is a nerve exposure, that means the nerve of this tooth has been exposed to outside. So I will clean this. I will numb her up first because she might be in a lot of pain. Okay, so I will numb her nicely, clean around the gum area, clean all the blood that we can see in the picture, and then I will do a medication on top of where the tooth is broken and do a temporary filling for her today on that tooth. Because in the next visit, that will be in 2 weeks of time, I would like to assess this tooth again and do the nerve test to see how it's
Yes.
responding.
Doctor, did you say that you're going to do a procedure or treatment? What's the name of this treatment or procedure?
We call it as sorry, Dr. But I don't know the name. We call it as cervix pulpotomy.
What does it mean, doctor?
So that means I will be putting a medication which will help this tooth with the nerve.
Okay, so you're going to preserve the nerve. You're going to.
Yes.
Okay, that is good then. I'm happy with this, doctor. Okay, so
And
what about the next door tooth then?
the next On the right hand side, it has moved out of its position. Okay, Michael. So what I'm going to do is with the gentle finger pressure, I'm going to put it back to its position. And with the help of a flexible wire, I'm going to attach it with the teeth next door
Doctor,
for a
when you
more.
say the left-hand side, do you mean your left-hand side or Sarah's left-hand side?
Sorry, Sarah's left hand side. Yes.
Sarah's left-hand
So,
side.
yeah, if we're looking at the picture, our right hand side. Yes.
Okay, your right-hand side and the left. Okay, I
Yes.
got it there now. That's
Yeah,
it.
yeah. So yeah, we will splint it because we have to splint because we need more stability because it can come back to its position. So we will be splinting it for the next 4 weeks. And when Sarah will be coming in 2 weeks' time, I will assess again. Okay, and then I will take an X-ray towards the end of the appointment just to check the position is right.
Okay, doctor. Is it really sore, doctor? Is it really painful what you do?
I will be numbing her up, Michael. So don't worry. I will look after her. So I will numb her up nicely before I start.
Doctor, did you say splinting? What does it mean exactly, splinting? How will you do it?
So Michael, we use a very flexible wire. It's like like we do the braces treatment for the for to fix our teeth, kind of like a similar concept where we in this one we will be using the flexible one. Okay, and then I will be attaching it with filling material to the adjacent teeth.
Okay, so it means like you're gonna get the thin wire and then gently join them to the entry tooth to the neighboring teeth, right?
Yes, yes,
How
that's
many
right.
teeth? Are you going to do from the front or the back surfaces, doctor?
I will do it from the front, Michael, because when I will be seeing for the next time, I would like to perform the nerve test so I can do it from behind. And it
And
will be easier for her to clean as well.
and doctor, which teeth will you attach the splint to? The wire
So
to?
I will do, if we are looking at these, the one, I'll just make it simple. Will do it canine to canine, which is the eye tooth.
The eye tooth. Okay,
Yes.
okay, doctor. That's okay then.
Okay, Michael. So look, we will be doing the treatment for her today, but there will be a few things I would like to be aware of and keep an eye on when Sarah is at home. Okay, so keep an eye on if she's having or developing any pain or if there is any pimple around these teeth. Okay, and if there is swelling, so bring her straight away to me, and I will have a look and assess her, and maybe take an X-ray as well at that time. Now, Michael, I would like to
Sorry,
inform
doctor,
you.
a question, doctor. Sorry. Are you
Yeah,
going
yeah,
to
of
take an
course.
X-ray today? And
Yes, yes. After
which
this
one?
plating, just to check the position, I will definitely be taking one X-ray.
No, before you do this?
Not before, Michael. We will just do it one after.
So no before, right?
Yeah, not before.
Okay, doctor. That's okay then. That's okay. So, yes, doctor, what follow-up is needed? Do you think really when do we need to come back again?
So follow-up wise, Michael, there are a few follow-ups, which one will be 2 weeks time. Then the other one will be 4 weeks, 8 weeks, and then 6 months. Look, don't worry, I will give you everything in a written form. I'll ask my receptionist to make all these appointments so we can send you the reminders. You don't have to remember all these appointments, okay? And each appointment, I will do my test to look after her.
Thank you, Dr. Jackson. Some
Sorry.
suggestion and advice that I need really. What do we need to do at home, doctor?
Otherwise, please avoid any further trauma. Having a really soft diet, nothing very hard to bite on the front teeth like apples. And I know it'll be really hard for her to brush her teeth at the front. So she can do like a normal brushing at the back teeth, but at the front, she can like use like a damp cloth to clean. Okay, and keeping up with the really good hydration is important for her. Okay.
So do you think really because she does play a little bit of sports, do you think really mouth guard can help in this case?
Yes, the reason that's why I was asking why, like, when did it happen? Was she playing sport? If it happened while she was playing the sports, then it's really important. If she has a mouth guard, you guys can bring it next time, and then we can assess the fit of it as well. And if
Okay.
it might have a pain.
Doctor, also, I'm just thinking about medicine. Do you think really you need to prescribe any medicine to Sarah?
I will check her weight, and then I will prescribe her Panadol accordingly.
Panadol. What about antibiotics? Do you really need because she has a big cut in her gum. Do you think really for the gum you may need antibiotics?
Not at this stage, Michael. There is no infection, so we don't have to give her any antibiotics.
Okay, doctor. That is great. Then I'm happy. Then okay, doctor. Anything else would you like to tell us? Let us know.
I will give everything in a written form, Michael, all the treatment plan and then all the appointments. So we will go from there. You can.
Thank you very much. Time's up. Thank you. How do you feel?
I wanted to explain the complications with the diagram, Dr. Bido.
That's okay. That's okay. No, like you did very good in 10 minutes. You did very good. Could you do better than this? I think that's just fantastic.
No, I can do better, Dr. Bido.
How? Tell me how. For me, you really did very good. That is enough. What you have did is enough. You haven't done anything wrong at all. Maybe maybe like only one point I need to discuss it with you. But the rest, whatever I have mentioned, like what you have mentioned about, we can discuss this together, okay? Are you ready to discuss the whole case together right now?
Dr. Bido.
Okay, guys. Clinical findings. You already have discussed clinical findings perfectly. You have discussed the gingival laceration, tooth 1 pulp exposure, and then the exaggerated cold test, cold response. That was fantastic. That's what you have told me. Tooth 1 no response, and tended to percussion. So this is the clinical findings. Now, diagnosis: tooth 1 complicated crown fracture. Tooth 2 has luxation injury, likely lateral. Pulpy testing, cold test check, nerve response. A strong response means inflamed but alive, which is tooth number 1. No response may be temporary shocked, but not necrotic yet. We cannot decide on necrosis right now. So far, you have mentioned all of this. Am I right?
I actually didn't name the diagnosis, Dr. Bido.
You said this bulb exposure, and you said this laxation injury. Do you want to say lateral laxation?
I think we should write in a diagnosis management.
You already said it. You already said it to me before before the stuff. You said that's lateral laxation, right? Which is the same thing. Now, the thing really which I want to really discuss with you is radiographs. We normally need to take radiographs before the diagnosis, right? To confirm the diagnosis. Am I right about this?
One after Dr. Bido.
Yes, but before for diagnosis. So we to confirm our diagnosis and to have a record what has happened, we should take a radiograph before. Do you agree on this? Or you don't? Is it just only must be after only, no before? Hello? Dr. Nat, I can't hear you. Hello, Dr. Nat? Look, if you talk and I cannot hear you, most probably it's my speaker then.
I'm here. Maybe it's your speaker.
Yes, maybe my speaker. Now I can hear. I'm here. Maybe your speaker. Okay. So, do you think do we need to take X-ray before or must be after only?
Not sure about the before, but we have to do after. But usually,
Okay.
I think in a clinical situation, we take X-ray anyways before.
Yes. So we need to take before, right? Because we need to know if there is any bone fracture, if there is any
Yes.
root fracture to confirm the diagnosis, right?
Yes, yes.
Yeah. So we do before to confirm diagnosis. So normally we take one periapical radiograph and two additional radiographs, most probably will be again periapical from different directions or angulation, horizontal or vertical. Occlusal, maybe you can add one more occlusal as well if necessary. Okay. Interpretation of results. Tooth 1 vital but exposed pulp. Tooth 2 possible transient loss of vitality. That is transient. And then we need to monitor. This explanation to the parents. One tooth is broke with nerve exposed. One tooth is knocked bruised, and both need for immediate care. The immediate management plan. Tooth 1 protect pulp and restoration. That's what you mentioned. You said temporary restoration. That was great. Tooth 2 stabilize the tooth. Manage soft tissue injuries by, as we mentioned, you clean and just maybe A little bit of saline will be okay. Tooth 1-1 management, partial pulpotomy, civic pulpotomy by using MTO calcium hydroxide. What is the goal out of this? To preserve the pulp vitality. And that's what you mentioned. Tooth 2-1, reposition and flexible splint. Now, splinting and RCT assessment. Flexible splint attached to adjacent teeth. After 2 weeks, we assess RCT and the vitality. 4 weeks, we remove the splint. You have mentioned all this stuff, right, Dr. Nev?
Yes, Dr. Bido.
Means like it, great.
Yeah.
Rest we discussed pulp necrosis. You discussed pulp necrosis. Tooth discoloration, I cannot remember if yes or no. Infection, you have discussed it. Need for RCT, root canal later, maybe if necrosis or infection. You want to only draw diagrams, right? For this part.
Yes, for this part, I wanted to draw a diagram.
It's okay. It's not an ideal situation all the time. Maybe next time, if you have more time, maybe next time, or if you have more time, you can really draw. But you have mentioned it. That's okay. Pain and home care. Soft diet. Avoid biting front teeth. Good oral hygiene, analgesic if needed, and no antibiotics. And definitely mouth guard if required as well. How the things now looks like for you? How does it sound to you? All this stuff.
Sounds good to me, Dr. Bido, like we discussed before.
Okay, very good. Follow up 2 weeks, but you didn't mention the follow ups, right?
I did mention follow-ups, Dr. Bido. 2 weeks, 4 weeks, 8 weeks. And then I didn't say 3 months. I said 6 months.
Yeah, 2
4.
weeks, 4 weeks, 6, 8 weeks, 3 months. Yeah, I forgot to put 4 weeks here. Okay, 2 weeks, 4 weeks to remove the splint, but we already mentioned above. And then 6 to 8 weeks, 3 months, 6 months, 12 months, and then 5 years. 3 years, 5 years. Okay. Okay, how does it sound to you right now, guys? How do you think about this case, and how does it sound to you, Dr. Neff? Hello?
Sorry, Dr. Bido, was there for me?
Yeah, for you. What do you think about the case right now overall?
It was good overall, I think, Dr. Bido. I think there was a bit of a connection issue, Dr. Bido. Otherwise, it would have been according to my expectations.
I don't know why you feel low about the case. However, it was good case, and I have heard every single word. Look, whatever I've mentioned, I have heard it properly. I didn't miss any. Did you miss any from my information or my questions?
Not from your end, Dr. Bido. It was from my end, I think.
I don't think so. I have during the role play itself. I didn't miss even one single word.
Dr. Bido, yeah, that's fine.
You want to do the role play again? You feel like you can do it better?
Next time, Dr. Bido.
Next time, then. Look, I tell you something. Can I tell you something?
Yes, please.
Okay. Don't look or expect for perfection. Because my experience, when you look for perfection, which I believe you've been perfect in this case, but always, you must be happy and satisfied with your performance, whatever happening, because that's gonna give you a good push to keep going, especially during the examination time. I have seen candidates they couldn't pass OSCE or they couldn't pass the second day or next day only because they actually felt bad about themselves and they passed that case, but they failed the next cases. Did you get my point? My like if I check, have you read the slides before? Beforehand, did you read the slides beforehand before you do the replay? No. Tell me what did you miss out of this?
I probably will say complications.
You mentioned complications to me. You mentioned I'm the one who was listening to you carefully, taking the notes, right? You mentioned about pulmonary necrosis and the infection, right? Hello?
Yes, yes, Dr. Bido.
So you mentioned something about it. So what else? Tell me. By the way, it's not about the quantity in the exam, it's about quality. As long as you give the right decisions, as long as you answer my question correct, as long as you managed me nicely, that's it. It's not about quantity. How many kilograms from information you gave me. Did you get my point? Yes. So please don't feel low. Okay? I mean, like, you did very good. Guys, how did she go, guys? People for part two and part one. Let me check the candidates. What they say about Europlay. Guys, please, guys, be honest. Don't make her just to feel happy. Guys, be honest. What do you think about Dr. Nav performance? Let me check this. Guys, everyone be honest, okay? Let me check. Look, look at Dr. Pranima. Mentioned she did very well. Guys, please, guys, don't just say things to make her happy. If you believe she didn't good, say she didn't do good, okay? Dr. Sandra, good. Dr. Shiva said, Doctor, you were good. You been too hard on yourself. See the people, very good doctor. Dr. Bavia. Dr. Sandra, good. Dr. Bonrima, Dr. Yashni, she did very well. Dr. Shreya, you did very good, doctor. And then Dr. Left say, when is your exam? I think you are ready. Everyone, did you get my point? You really did very good.
Dr. Bido, what was your feedback?
My feedback, everything was perfect, except only one point for the x-ray. You
Sure.
still need to take x-ray beforehand for diagnosis. Apart from this, your language was very clear. Your responses was very good. You've been very caring dentist. Your decision was very good decision. You have covered every single finding, including gum laceration, including pulp exposure, including lateral laxation. You covered all of them. You managed all of them. You listened to me. You managed my stress. I was very anxious. All my questions about splinting, about prognosis, outcomes, you managed them nicely. So what else I want as a dad? Follow up visits, complication, give me advices, give me medicine. You gave me medicine. Everything was perfect.
Dr.
Clear right
Bido.
now?
Clear, Dr. Bido. Thank you so much.
No worries. Okay. Thank you very much, Dr. Nev. Thank you, guys. I hope guys got help from this session. Thank you very much, guys. Thank you very much, Doctor. You see, even Dr. When you said you did well, very calm. Most important, you make Michael calm. Yes, that's what I tell the Dr. Winnie. Very good. You make Michael calm and you are caring. That's all you need for an emergency. You responded really well and it was really calm and clear. Dr. Nav, you were good. Best luck for your exam. Dr. Bavika and Dr. Ramin. Okay, thank you very much, Dr. Nav. Thank you, every one of you guys. Have a great night. And by the way, the mock exam, very important. Mock exam. I was thinking, guys, to make mock exam tomorrow, but I may give you a little bit of time to read more because I will share with you tonight the topics the exam will be on, so you guys can revise them and go them. You can go through them as well. Okay. Thank you very much, guys. Have a great night. See, the mock will not be tomorrow. The mock will be after tomorrow. Tomorrow is Wednesday. We can have session Wednesday if you like. I will announce with the Facebook. If you like, guys, we can have a session tomorrow, Wednesday, and the mock exam on Thursday, if you like. Thank you very much, guys. Have a great night, every one of you. Thank you very much, you guys. Have a great night. Thank you very much. Bye bye. Dr. Saunders will give antibiotics if it was a bulging case, or if there is a deep cut onto the bone. In this case, we can give antibiotics. Deep cut, we can give. Thank you very much, you guys. Thank you, Dr. Punima. Thank you, Dr. Shreya. Thank you, Dr. Winnie. Thank you, Dr. Sanchari. Thank you, Dr. Saunders. No problem. No problem, Dr. Saunders. Thank you, Dr. Bisho and everyone. Doctor, can we make that's okay, Dr. Bisho? We'll be extended to Friday as well. So you can attend the Friday mock as well. Okay? Thank you very much. Thank you, Dr. Hassan, every one of you guys. Have a great night, every one of you guys. Thank you very much. Mock guys will be on Thursday. Tomorrow maybe we can have a session, okay? Thank you very much, you guys, for important topic. Thank you.